I get a lot of patients that come in and say, Dr. Van Dyke, I want to have a complete thyroid panel, a full one. I don't want just 1 or 2 tests. Well, let's talk about the complete thyroid panel. And if you've watched the video about the thyroid hormone conversation, this is going to make a lot more sense. So you should look for that on the channel. But the complete thyroid panel actually has a lot of stuff in it that is superfluous, that you can get that same information and draw the conclusions from far fewer tests. There are a number of things on that panel that are not useful at all. They have no role in diagnosis or management of, say, simple hypothyroidism. Maybe it's only relevant to thyroid cancer patients. And there's this big controversy about reverse T3. And I will tell you, I mean, I've been doing this for a long time. I'm board certified in endocrinology. I've spent years of my life studying this. Reverse T3 has no bearing in therapeutic decision making. Reverse T3 it's kind of a backup process. So let's say that you have a normal thyroid and you get sick and you have to go to the hospital and they have to take care of you, and eventually you get better and you get to go home. Well, during that acute illness, your reverse T3 is going to ramp up like crazy. And the point is that when your body is trying to handle an acute illness, it does not want extra stimulation from thyroid. So it's going to shunt off some of the thyroid hormone down this reverse T3 pathway because it is inert. It can get rid of that extra thyroid hormone without any real consequences. And simultaneously in this situation, the pituitary is going to downregulate that TSH, again, because it doesn't want to be asking for extra stimulation. So a complete thyroid panel, in most cases, is going to be expensive and largely unnecessary. You can get all of the necessary information you need out of seeing the TSH, which is the most sensitive indicator of what's going on in the thyroid conversation, and the free T4, or how much of the T4 is available to be used in the reservoir. And everything else can be extrapolated right from those 2 things.